Creating and evaluating student learning outcomes. This presentation was created by Lynette Washington, Senior Instructional Designer for City, and is narrated by Angela Solik, City Director. Learning objectives. The important thing to know about learning objectives is that they are statements that you write that clearly describe what your students or your learners should know or be able to do after completing a lesson or a module, an activity, a training, or anything of that nature. You write learning objectives ahead of time before you start teaching or designing a course or a learning experience. Learning objectives follow the SMART guidelines, which are specific, so they focus on one particular skill. Measurable, you need to be able to observe or test if the objective has been achieved. And this particularly confuses faculty members because there are some verbs that are not measurable. Achievable, it's realistic for the learner to be able to accomplish this particular objective. Relevant, it needs to be connected to the overall outcomes of the course or the activity. Those course level or higher level activity outcomes or objectives need to align with the specific learning objectives of a week or a particular activity. And sometimes these objectives are time-bound as to when the learning should occur, but sometimes they are not. Writing a learning objective is a skill. It is not something that comes naturally to anyone, especially people who've never been taught how to teach. So writing the learning objective, you need to be as specific as possible. Make sure that the verb you include is measurable. More on that in the next slide. And focus on the outcome. A well-written objective is going to tell you and the students what the learner should be able to do after instruction. This is Bloom's Revised Taxonomy. This is one of the most amazing resources for you to be able to use to design any type of learning activity or course module. If you see, the lower level is remember, and the highest level is create. So depending on what you want your students to be able to do, the objective is going to be written somewhere on this hierarchy. Just because remember is at the bottom doesn't mean that it's the worst type of objective to write. That is not the case. But what's important is trying to combine different levels of Bloom's taxonomy throughout the learning experience. If you see these verbs, such as identify, match, or recall, classify, discuss, summarize, apply, develop, organize or implement, analyze, differentiate, coordinate, conclude, test or judge, and in the end, to generate or to produce or to construct. Underneath these particular areas of Bloom's, you will see some items that you could use to measure the objectives that you write. So under remember, that's where quizzes that have only multiple choice, true, false, or fill in the blank questions, that's at the lower level. Up at the top, you have projects or presentations. You can find a copy of Bloom's Revised Taxonomy on the internet in a lot of different places. There are also files that you can find with a lot more verbs on there, Bloom's Taxonomy verbs. So you can look that up on the internet and print it and keep a copy next to your desk, which is what I used to do back in the day when I would design courses and teach students. On the right-hand side, it's very important to pay attention to words that you should not use when you are writing learning objectives. One of the ones that is used most commonly by faculty members is understand. Another one is learn. So writing an objective that contains those words is an objective that needs to be revised using different verbs. You can use the ABCD method as a guide while you're writing your learning objectives. A stands for audience. So who is the learner in this particular circumstance? You can start your objective with learners will, participants will, students will, etc. The next is B for behavior. So what are they going to be able to do? This is where your action verb comes in. This is where you look at the Bloom's taxonomy verbs and you figure out what is it that I really want to measure here. So that's where you choose your verb, such as identify, solve, create, compare, etc. The C is the condition. Sometimes you might not have condition in your learning objective. So don't be afraid if you have a learning objective that doesn't exactly have a condition, but usually what the condition is what the student is going to be doing. So the examples here in this chart are using a calculator or after watching a video. Sometimes you might also have a degree. That's letter D. So how well must they do that? With a certain percentage of accuracy, for example, that might be where you have a degree. Or a number of minutes, for example. Here is an example learning objective. After completing the communication module, healthcare professionals will be able to demonstrate 3 evidence-based techniques to build rapport with patients during an initial consultation. So here's where you can see where A, B, C, and D are included in one objective. If you want to go back, it's audience, behavior, condition, and degree. To assess whether or not the students are achieving the learning objective, building rapport with patients, you're going to want to break that down into steps or skills or activities, and that's what you include in your learning module. So for example, building rapport with a patient might involve establishing trust, showing empathy and respect, communicating clearly and actively listening to the patient, creating a comfortable and non-judgmental environment. So creating the learning objective isn't enough. The students need to understand, there's me using that word understand, but I'm not writing an objective, so it's okay. The students need to understand how they are going to build rapport with a patient, and this might be included in the course materials that you provide the students that will break that down for the student. Align your objective with your learning activities. So here are some examples of activities that would align with that previous learning objective that we just showed you 2 slides ago. They could do role-playing with feedback, such as mock patient interviews. They could observe videos of effective and ineffective patient interactions. Now, those videos can be found on YouTube or elsewhere. You don't necessarily have to make your own videos, but hey, if that's something you love to do, go for it. They can practice active learning techniques such as paraphrasing what the patient is saying and using open-ended questions to probe a little bit deeper. They could learn about cultural sensitivity and nonverbal communication skills, what to pay attention to, what the patient is saying or not saying. They could also be involved in reflection exercises, such as reflecting about their experience with these interactions with patients. The students don't have to do all of these. That is not what we are suggesting. What we are suggesting is choose one or two activities that align with the learning objective. Sometimes just one activity will completely align, and that's great. Sometimes you might need two. Let's look at a poorly written learning objective, and here it is. There's that word again. Understand how to communicate with a patient. That is extremely vague. It doesn't have specificity, it is not measurable, and does not have a clear action verb. Understanding is not something we can easily measure. It's very subjective. There's no way to assess whether the learner has successfully met this learning objective. It lacks conditions, it lacks context, and the word understand is very vague. These are the 4 main reasons why a learning objective would be written poorly. So these are what you need to pay attention to when you're evaluating your own learning objective. Remember, look at Bloom's taxonomy for some wonderful examples of action verbs. Usually your action verb is right after the learner will be able to, and that's where that verb fits in perfectly. If the verb or the learning objective is not measurable or accessible. If it is missing context and conditions. We want you to be able to design and write excellent learning objectives. So here is a comparison on giving vaccines. Students will be able to understand how to give vaccines. It's poor because understand is not observable or measurable. It doesn't specify what the learner will be able to do, and that just doesn't define how success will be assessed. A better learning objective is demonstrate proper technique for administering an intramuscular vaccine using a training mannequin following CDC guidelines. I hope you can see the major difference between the poorly written objective and the much better written objective. Let's move on to assessing learning objectives. To assess the learning objective, you need to use assessment tools. So some of those assessment tools might be a checklist or a rubric for evaluating rapport building in video role plays or simulations. This is going back to that well-written learning objective about building rapport with patients. You can use peer feedback. You can use your feedback to the student. You can offer students self-assessment questionnaires to assess how they feel about their own rapport building in the learning situation. And if you're in a clinical setting, you can use patient feedback surveys or patient questioning. You do not have to use all of these assessment tools. These are just options to be able to assess that learning objective. The next 3 slides are going to show you a rubric for assessing a student on the learning objective about building rapport. This particular rubric has 7 criteria and is worth approximately 28 points for the student. Rubrics can be created within the Canvas Learning Management System if that is what you are using in your learning situation. If not, you can always create rubrics outside. All you need to do is Google Rubric Creator for free or something like that, or use generative AI to make a rubric. What you need to know about your rubric is you need to know the criteria. Sometimes that's not the simplest thing, right? But coming up with a criteria is very important. Generally speaking, a rubric will have excellent, good, fair, needs improvement, or some other way of saying the same thing. And you break down your point values appropriately for whatever your point level is for your situation. If you look at this first start of the rubric, the criteria are introduction and greeting, nonverbal communication, respect, and cultural sensitivity. The different items in excellent, good, fair, and needs improvement describe behaviors that the students will exhibit when you are assessing the particular learning objective. I will give you a moment to read through those different parts of this rubric, and if you need more time, please pause the video. Here are the next 3 criteria for the same rubric: empathy and emotional sensitivity, active listening, language, and clarity. One thing to keep in mind is that there already might be a rubric out there on the internet that is assessing a similar learning objective. So you can also Google to find rubrics, but you just need to be specific about what you're trying to measure. You can always download that rubric and edit it to fit your particular situation and have somebody else do most of the work for you, which is kind of ideal that you don't have to spend the time to do that. If you would like to read all of the different categories, please pause the video. The final category is trust and comfort. This is potentially like the most important thing when you're talking about building rapport with patients. So having a rubric really helps students to know what you're going to be assessing them on. It makes it very clear there's no muddy water, there's no grade without a full explanation. This is helpful for you and helpful for students. Let's move on to analyzing data. When you're talking about designing a learning experience for students, and you have learning objectives, and you have rubrics to help you measure how the students have met the learning objectives, you get a lot of data. And those data can help you figure out, do you need to change what you're doing? Are there issues? So assessment data can be quantitative data from test scores or quiz scores or rubric scores. You can also have qualitative data from students' open-ended responses, from observation notes, portfolios, student behavior, or if you have surveys in the middle of your learning experience, those data can really help you analyze, how is this learning going for the students or the people taking your learning experience? Compare your data to your learning objectives. Make sure you're matching your assessment item to a specific learning outcome or learning objective. For example, if you're noticing that students are having issues giving vaccines, remember we had a learning objective about students being able to give vaccines? Let's say that the students are making a mistake, and that mistake is common. Then you will understand fully that there's an issue somewhere. It could be an instruction, it could be the type of video you're giving the students, it could be the type of activity that you're having them perform as part of their assessment. When you get assessment data, you need to look for patterns and trends in that data. For example, if you're giving your students a quiz on vaccines, perhaps the students kept getting question number 4 wrong. That's very interesting data because that's showing you that multiple learners are struggling with question number 4. Look at that question and think, okay, what's being measured here by this question? And what type of instruction did I give the students? And maybe you will see a gap. And then you can fill that gap. Depending on what that gap is, you might need further instruction, you might need a video, or might need some remedial materials for your students. If you don't want to make any changes right away, you can compare data over time. For example, if you are teaching the same course in an asynchronous online format, but also teaching the same course in a face-to-face format, look at those assessment data. Are you seeing something different with the online students compared to the face-to-face students? Maybe it's part of the method. Maybe. You can always look at individual students over time, looking at their assessment scores to see if they're getting better or if they're getting worse. If they're getting worse, you'll definitely need to reach out to that particular student and see where the problem happens to lie or if the student is having difficulties. If you're in the position where you can compare different classes by different instructors, those data might be really interesting as well, because not every instructor teaches the same way. And perhaps one instructor has a phenomenal idea about how to teach, how to give vaccines. And you can share that information with other instructors if that instructor is amenable to that. How to make changes based on the data that you receive. This is where we look at the gap analysis. Remember when I said that a few slides ago? Find some gaps, find some weak areas. Are you noticing that some learning objectives are not met by students and it's becoming a common thing? You can see which skills have low performance. Are these with individual students? Are they with specific student groups if you use them? Or if this is like a course-wide issue, to know it doesn't depend on the instructor at all or the delivery method. So that's some analysis that you need to be able to do, maybe by yourself or with other instructors. Figure out what the root cause might be. It could be the instruction. It could be that the students aren't given enough practice or enough time. Maybe the assessment that you designed was just too difficult or too challenging for the student. Or maybe there are external factors if it's with a specific student. Once you figure out what the root cause might be, then it's time to make targeted changes. If you realize that the students in the class don't have enough foundational knowledge coming into the course, you might have to provide a review module or some prerequisites before the students can advance to another module. If the students are learning but not really being able to apply that knowledge, like using a mannequin to give vaccines, you might want to provide some real-life examples or some role plays or some simulations. Some way to practice. If a concept is misunderstood, as an instructor, you might want to break it down a little bit differently. Students might need a video. They might need a different type of visual, like an infographic, or maybe some more examples. If you're finding that there are language barriers, you might need to simplify your medical language if it's a medical situation. If there are students with different first languages, you might need to provide some bilingual resources. You also might need to revise the learning activities that are associated with your particular learning objective. One way to do that is to add interactive activities or practice-based activities. If the concept is difficult for the student to understand, such as memorizing pharmacology terms, you can use an interactive tool like Quizlet.com, for example, which is a free tool, and it provides students with hands-on practice that is very engaging. You can also get students to work together, either with group discussions or having group-based case studies. You can also use peer instruction for active engagement. For peer instruction, that takes a little bit of planning because you have to plan in advance who's going to teach what concept to the rest of the class. Assign those things and make sure that the students are performing on their said date. That can be done face-to-face, online, or blended. You might also need to adjust your assessment tools. Sometimes test questions are very poorly written. You might want to check that out. Sometimes questions are confusing, so if many students are getting the same question wrong, you need to look at that question quite closely and get help if you need help. Have somebody objective come in and see what that question is like. Perhaps the questions are not aligned with what you said you're going to be measuring. That happens a lot, especially if you're using test banks from publishers. They do not always align with what you've covered in class. Try to balance the Bloom levels. We talked about that previously. You don't want to have all of your assessment tools be quizzes or exams. Feedback is extremely important to your learners. Make sure that the students know what they've done well and areas they might need to work on a little bit more. Assessment data should be used for formative feedback and not just final grades or final assessments, which are summative feedback. Formative feedback helps students to learn what they're not understanding or they're not getting. Provide students with some extra help or tutorials to bridge the gap in their learning. Thank you so much for listening and have a wonderful day.